and speak to Dr. Ahmed Alfarra, who's the Director of Paediatrics and Maternity at Gaza's Nasser Hospital. He's joining us from Khan Younis. Dr. Alfarra, thank you for your time. Can you describe to us first the cases you've been seeing lately as we see these latest deaths, famine-related deaths? How do these cases differ from what we've seen since the blockade started 5 months ago?
You mean the event that happened yesterday?
Indeed.
Again, please?
Yes, the latest famine-related deaths. Can you tell us more about those and how they compare to the ones from the previous months?
Okay, the famine-related death is coming first. Thank you for having me. The famine-related death is coming every day for the reception room in Nasser Medical Complex. As we mentioned before, the severe acute malnutrition is one of the most horrible and challenging for doctors for treatment. It's not easy. It is not like pneumonia and not like meningitis and acute pharyngotonsillitis. It is all diseases of pediatric are treating for 7, 5, 10 days mostly, and then discharge. Except the severe acute malnutrition, sometimes the patient need to be admitted for 1 month and sometimes 2 months and sometimes 3 months, and should be followed up. So we give an example like a dark tunnel for the severe acute malnutrition. Sometimes the child is getting this disease, but we don't know if he can get outside or not, because it is not easily to treat it and it's not easily to be without complication. And we are afraid about the complication of severe acute malnutrition.
Yeah, and I'll ask you more about the long-term effects of this and the complications that you talk about. But Dr. Alfarra, the Israelis are pointing to allowing in shipments of items like biscuits and chocolate as proof that they're permitting food into the Gaza Strip. Can you tell us how these items, are reaching people, and do they, in fact, have any nutritional value for families and for children who are facing starvation in Gaza? Okay,
first we have to differentiate between two things. Sometimes we will, when talk about severe acute malnutrition, we have two types of severe acute malnutrition. Severe acute malnutrition, which is primary, just severe acute malnutrition without other disease, and we have secondary severe acute malnutrition on top of a chronic disease. Sometimes when the media is talking about a case, you found that the media against that are talking about this is a chronic disease. Okay, he's a chronic disease, but also he's complaining from severe acute malnutrition. If he's a chronic disease, he needs more attention, he needs more calorie, he needs more treatment. So it is not an acute for him or something to be dying in a chronic disease. This is the first. Second, we have a lot of cases of a primary acute malnutrition that they were not complaining from any disease. They are just having severe acute malnutrition due to unavailability of the food or milk for this patient. And we have a lot of cases in the stabilization center in our hospital. I would like to mention that we facing and we are in a challenge of increase a lot of cases and increase the number of cases of acute severe malnutrition. Right. For example, we have an outpatient clinic in our hospital which is working in Saturday and Thursday. In the beginning of the famine, they used to see 10 cases or 15 cases. Today, they told me since half an hour that they examined 120 cases. That means that we have nearly 10th-fold that the usual number. We have increased the number, and we have to mention that if the occupational forces are talking about that the food is coming in.
Right.
Again, Gaza needs 600 trucks, and the number of trucks that get inside Gaza nowadays is just 50 in the best condition.
Dr. Alfarra, let me ask you now about the consequences. I mean, even if the war stopped tomorrow, what are the long-term health consequences? that Gaza's children will face from this period of famine?
Okay, this is the most that we have to mention, and we have to make the audience and everyone to take care about that. We have three phases of the acute malnutrition. The phase one is the immediate phase, which is may last for 2 days, and the second phase we called it the adaptization phase, and which is may last for nearly 3 or 4 weeks. The most serious is the third phase, which is coming after 4 weeks. And all the children and all the pediatric in Gaza are now in the third phase, which is after 4 weeks. What is the characteristic features of this phase? This is permanent changes in the patient, that it is irreversible. That means if the food is available for this patient, they will not recover. For example, they have affection on the growth hormone. Mm-hmm. They have a growth hormone deficiency. They will be in short stature in the future. Even the food, if was available, they will not get the ultimate high for them. They will have some affection on the thyroid gland. The thyroid gland is the maestro of the metabolism of the body. The child will complaining from inability to think, hypomentality, low IQ, low interaction with the school and the school performance. Yeah. Also, we have affection on 6 hormones. They will maybe complain in the future from infertility and delayed puberty. The most serious complication is the affection of the central nervous system. The central nervous system need B1 and B6 and B12 and need polyunsaturated fatty acids, which is unavailable in severe acute malnutrition. These babies may have a problem in cognitive function, in comprehension, in talking, in solving problems, in interaction with the media, interaction with the community. School performance will be affected, and unfortunately, this effect will be permanent even if the food is get inside and they were refed, unfortunately.
Thank you so much, Dr. Alfarra, for taking the time to speak to us about this and explaining clearly the consequences of this Israeli man-made famine in Gaza. Dr. Ahmed Alfarra is Director of Paediatrics at Gaza's Nasser Hospital. Thank you so much for your time.
Thank you. Thank you, Mike.
Don't miss out. Get the full picture. Subscribe to Al Jazeera for reliable news and expert insights. Like, share, stay ahead.